Well, I'd like to introduce to you our panelists who are with us tonight. Oh, and I left their little signs over here. I'll grab them in a minute. Our first panelist is Ayman, Mukerji, Househam. I think I kind of did that. She's a mindfulness teacher and a neuroscience researcher and a therapist in training at NYU. She has worked with pediatric patients with autism spectrum disorder and ADHD, and she has one of the papers that she wrote about ADHD. There are a number of photocopies. If it's something that you're interested in, you can grab one on the way out. It's in our table out in the hallway. She's worked with children with ADHD as well as other children, caregivers, and the elderly. Her research on the beneficial physical changes associated with a stress-free life are being published in the journal Advances in Mind-Body Medicine. Please welcome Ayman Mukerji Househam. Our next guest is Nicole Nardizzi. She is a qualified mindfulness teacher, and Dragonfly Wellness, who is our screening sponsor and located right here in Ossining, offers her 8-week course, which is called Mindfulness-Based Stress Reduction. Nicole is the founder and clinical director of Village Therapy Group in Briarcliff Manor. She's included mindfulness techniques in her therapy practice for years, teaching her students strategies and tools to manage anxiety, depression, and stress. Please welcome Nicole Nardizzi. So I'm delighted to see we have such a good turnout here this evening, and usually what happens is about 10 people want to have the last question, so don't be one of those people, and does somebody have a question that they think would be a good way to start our conversation? Okay, very good. I knew somebody would jump up.
Hi, I'd be interested to know what schools in Westchester are using mindfulness, as far as you know.
Like in your mouth, really close.
Here, you actually have to take it out of the.
Hello?
There you go, you got it.
Can you hear me?
Yep, you just have to hold it.
So as far as I know, I don't know of any schools in Westchester that are currently using this, and that's very disappointing.
You know, I see that there's I think the librarian from the Ossining High School, where she's right up there, and I saw another hand go up. So there is some mindfulness practice going on here in Ossining, and it looks like I have 2 people who might be able to speak to that.
Just from my experience in being in Ossining schools, we've been using mindfulness at different grade levels. Kendra from Dragonfly has been coming to us, so we just started it this year. But apart from that, I've been in different workshops in OCs and different educators sharing what they're doing in their schools. I believe Sleepy Hollow is using it, or Tarrytown, I've heard of that. And in fact, someone from Briarcliff did a whole presentation on mindfulness. So it's happening in Westchester. It's just, I think it's not known yet, or it's happening in small pockets. And it's really growing. It's a big movement. It's just taking off. And this year we just started at Ossining High School. Matt Clayton and we did a grant, and we opened up a room, mindfulness room in the library. And so we're still in the infancy stage, but this is catching on. So.
Outside of Ossining, I know in the Chappaqua schools, there are several ways in which it's been being used for the last couple of years. They got a grant to do a pilot project in, I believe, kindergarten and first grade classes, and teachers were interested, volunteered to get trained, and then began introducing it in their classrooms. And they did a pilot project that went on for a couple of years, and I have to say with unequivocal data that came out of it, that kids, there was much more capacity for kids to manage their own behaviors. There was a lot of conflict resolution that was monitored on the playgrounds and some of the unstructured places. Kids learned to lead the mindfulness meditations, and I had the good fortune of interviewing some of them, and it was really extraordinary to hear how their consciousness at the ages of like 5, 6, 7 changed with the experience. There's a proposal on the table to introduce it in the Chappaqua schools K through 12, which has yet to be, I guess, completely finalized. But I will also say the #1 most popular class in the high school is a meditation. It's called Walking and Meditation, and the teacher does mindful meditation. I've been in a number of different kinds of settings myself, observing it. I think it's a no-brainer. It doesn't cost a lot, doesn't take a lot of time, and the results were, seeing in this film are reproduced everywhere.
There was one more person here who wanted to comment about something going on in the community.
Hi, and in the Ossining schools, we piloted Calm Classroom over the summer in our summer school program, and many of our elementary school teachers continue with Calm Classroom during the school year. Additionally, we, as a complement to our summer reading program, had yoga instruction twice a week for the children, and part of that was mindfulness. And one of our occupational therapists, as far as for his professional growth plan, became a pediatric yoga instructor and does a lot of pushing into the classrooms at one of our elementary schools. And the students remind one another of some of the mindfulness techniques.
These are some good local stories. I'm glad to hear things are going on locally. And I would also just like to point out that there are some programs going on in the community, not just for school children, but some of us adults aren't so mindful yet. James was just whispering in my ear that 4:30 on Friday afternoons there's a meditation program here at the library. I know that's not the only one. I believe First Village Coffee is doing Mindful Mondays. They have a schedule for that. And so those are some of the things that you might want to, if you have information about where folks can go for some meditation or mindfulness programs in the community, please add it to the additional resources here so that we might see each other in the community later on as we explore this further in our lives. So we haven't gotten to hear from our panelists yet. Perhaps would you like to offer some of your thoughts either on the film or on your practice?
Sure. So I actually live in the city, so I wasn't very much aware of what's going on in Westchester, but it's very impressive from what you said. And I do teach mindfulness to kids and the parents. And the results are tremendous, especially when both parties can do that. I heard one child, a kindergartner, say after meditation, she saw herself inside when she closed her eyes. And that is huge. And a lot of us adults don't know how to do that. But if you are a parent or not, I think it's a great idea to start with our own practice as adults before we could introduce that at home to our kids. And then if we want to bring mindfulness to our relationships with our kids, our spouses, partners, maybe invite that relationship to be mindful. In other words, listen before talking. Maybe repeat what you heard. Those are a few practical cues of bringing in mindfulness to relationships, including those with our kids. Those are just insights. Of course, I have a lot of other thoughts, but I'd wait for someone to ask questions.
Thank you. And I know there probably are more questions. So does somebody have another question for our panelists?
So I just wanted to
Please,
also point out that the documentary is wonderful and heartwarming to see the change occur in these children. But I also want to point out that it's not just for children, of course, and also for adults, but children who have anxiety. So it doesn't have to be behavioral. It can also be other issues that our children are dealing with, having to do with stress related to school, related to peers, related to family issues. And so it's not just a matter of correcting behavior, it's also a matter of learning to cope and having the tools and the skills that you acquire with learning and developing some kind of a mindfulness practice. So I feel I've been working with children for 25 years, and one of the reasons I got into this and became a teacher of mindfulness, NBSR in particular, was because I felt like the children were really at a loss of what to do. Okay, I can go to therapy, and also for adults, I can go to therapy, but then what do I do when I'm not in front of my therapist? How do I manage myself? How do I manage my life and all the things that come into it and all the stresses around it? So I feel like that's just another point I wanted to make about the usefulness of it.
Thank you. And I just want to give the audience a heads up. Tonight's going to be a little bit of a different format because after we have some Q&A, we're fortunate it was a relatively short film, so that gives us a little more flexibility in how we use our post-film discussion time. We're going to ask our panelists to lead us in a bit of an exercise, so we have that to look forward to. But I think I saw a hand over here. I'd like to give everybody a chance.
Oh, just a question about what you do for the 5 or 6 children who weren't in the class. And what can you do for the children who aren't appropriate for this? Do you have a special class for them?
Yeah, was it? Did they didn't take the kids out of the classroom ultimately, did they? Yeah. Okay. Yeah. It wasn't entirely clear to me either. Yeah. They returned. Yes, they did. Okay. Are there more questions? I thought I saw another question over here. Yes.
I just want to say that Mindfulness Works. I utilize it all the time. I work with the hospitals and especially all the sleep disorder centers, and I do all the outreach to the communities at all the healthcare fairs, events, and I lecture around the area about it. Because the main problem is anxiety, stress, and depression, why people can't sleep, especially the women. Their minds are more active than the men. And I've spoken to, at Burke Rehabilitation Hospital, to the brain trauma patients with the caregivers and the doctors there, that it's important to relax the mind. And the mindfulness training works. Also, besides that, there's about 20 different ways of breathing exercises to focus the mind. Also, visual imaging, whatever calms you down from the past, an image of being with your parents at the beach, whatever it is. Now also, I spoke to a lot of men who were the commanders of the Navy SEALs, and they said they can't let themselves stay awake thinking about everything, because if they're tired, a lot of people die in the missions they go on. So they create visual images that are very effective. And one is, if you have a lot of thoughts coming into your head, you have to think of yourself as a traffic cop with a big red octagonal sign right in front of you with the word stop. Anytime a thought's coming in, you say stop, you're the traffic cop. It does work. Everything takes practice, but it does work in calming. It doesn't have to be when you go to sleep, it can be when you're driving, because I know with a lot of seniors, they're so distracted, they're not keeping their eyes on the road and what they're doing. You go into the mindfulness therapies, and it does work to keep everyone focused.
Thank you.
I'd like to ask about your research on ADHD as well as working with autism spectrum children or adults. What have you found? If you can address that.
Sure. So the findings are really promising. Of course, in clinical setting, to prove that mindfulness as an intervention is the best or better than medication or same as medication, there are 4 stages that an intervention, mindfulness as an intervention, needs to pass. It's sort of in its youth right now. So mindfulness as a therapy model needs more fleshing out. However, our findings are really promising at that. So ADHD is often accompanied, either for kids or adults, is not being able to sustain a certain amount of attention that's appropriate for that age, being hyperactive, fidgety. Those are some of the things that, in people that suffer from ADHD. Or also the brain changes in that, their executive functioning is slightly different than others. And that makes it harder to focus. The reward circuit where dopamine gets secreted, the feel-good hormone, when we get a reward, needs more dopamine to be secreted. That's why probably they're extra fidgety, to get some action. So all of those observations map very neatly into how mindfulness works. In other words, when you are mindful, you are focusing your attention in the present moment. And so I'm explaining how it works in context of ADHD very well. Every time your mind gets distracted, like you said, you ask it to stop. So you say, okay, it is distracted, then I pause and bring it back to the breath. It could be other present moment anchors, such as our senses, our body, our touch. Once we practice that on a regular basis, just like we go to the gym, we practice how to do that to our mind. What happens is when, in case of ADHD particularly, let's say it does get distracted very easily. Oh, there is that signal in my mind. I know from my practice, when it gets distracted, I bring it back. So what happens is you're essentially developing a muscle memory to bring yourself back into the present moment attention. What also happens is, as we do that, we learn to respond to stress or stressful situations as opposed to react and become emotionally disbalanced. And that applies to everyone else as much as it does to someone who is having a little bit of a problem from ADHD or autism spectrum disorder, because those are often comorbid with depression, anxiety disorders, as you may have seen. So all of those are actually findings that we saw in our research, that it does help with ADHD patients. Now, there are several ways of delivering mindfulness to people or kids, for example, who are suffering from ADHD, is first having the parents learn mindfulness. That's the biggest thing. Because, like you saw in this kids' cases, they were kind of being forced to be mindful, and they didn't want that. If it's much easier if at home or the teachers could practice mindfulness, which is what they did, at least with the teachers. You saw him sitting through the mindfulness sessions. Second way of delivering it is actually doing it with the kids, especially as they grow up, become preteens, and older people. The third way is introducing it to schools, like here we did. So those are some of the findings, definitely promising. In some cases, they found that people who were taking antidepressant for a comorbid depressive disorder, they had to take less medication. Ritalin doses were also, in some cases, especially a study by Singh and group, who has done a lot of studies on ADHD and mindfulness. They noticed that Ritalin, in some cases, had to be discontinued. But that said, the research is still being done to prove the efficacy.
Thank you. And as that's actually the topic of one of the reports that Ayman provided, and there are some copies here if anyone is particularly interested in the ADHD portion of this discussion. As I wait for somebody else to raise their hand, I just wanted to ask, there are, I know, Nicole, you teach workshops in the area, mindfulness training, and this film is obviously focused on children. I imagine your clients are also adults. And we all carry one of these in our pockets, and there's apps that can help you sit still for 15 seconds or something and listen to water or whatever it might be. Do you have a recommendation for how people in our community, adults in our community, might further explore from wherever they're at right now, how they might learn to develop their own practice, or what's an easy, attainable, accessible strategy for the average person?
Okay, so the concept of mindfulness, as she was just saying, is living in the present. And there are apps and there's videos and on YouTube, but of course I'm going to recommend the course that I teach, which is Mindfulness-Based Stress Reduction, MBSR, that was originated and developed in 1979 by John Kabat-Zinn for treatment of patients suffering from illness and pain. And then it brought it into mainstream, and it's now a global program, so it's 8 weeks. I offer that at in Briarcliff. I just recently this week opened something called the Meditation Loft, which is right above the Moonbeam Cafe. And I have a group of middle schoolers who I'm doing an abbreviated MBSR course with. And also individual mindfulness training and shorter workshops for people who don't want to make the commitment to 8 weeks. So, interesting. Thank you.
Thank you. What I really appreciated about the film, it's more a comment, is that instead of punishment, they were using a tool. And I think we really have to get away from punishment. I'm reading a book now about people who end up in jail. And this one young boy, he was falling asleep like in kindergarten because his family life was so chaotic, and they would punish him instead of delving into the problem. I don't know if I should go here, but I'm going to dare in this group. I was I was wondering in a group like that if they would have related sooner to somebody from their own background. Like I felt in this film that the teachers were predominantly white and the children weren't. And I just want to say, one of the things that I found for me when I can't do my longer, quiet time, because I was always rushing my whole life. It was the way I did things. And I came up with a way that in my transitions, if I was on a subway, in the grocery store, in the car, before the next thing, I would take a moment. I didn't time it, but sometimes I would think about where I was going next, the people I was going to see, sending them goodwill. And it really helped me. I had to go to a very sad funeral, but I found at these moments where before I really didn't have the emotional poise, that those moments built up and really helped me to meet the things that we all deal with. Thank you both for what you're doing. I was actually with Maharishi Mahesh Yogi. My husband dragged me, but it was from another planet, and it's really remarkable over the decades what's happened. There's a wonderful book that I'll write up there. It's Thich Nhat Hanh, Planting Seeds with Song, Practicing Mindfulness with Children, and it has some wonderful exercises in it. Thank you.
I have two questions, one qualitative, one quantitative. The first is, in your experience, either with your own practice or in what you're working with other people with, if you're seeing over time a change in consciousness, which I know is a sort of abstract idea. The other is, for those of us who are trying to bring mindfulness into school populations, if you have any recommendations about sources of data. You know, one of the things that helps when you go to get a grant to bring it into a classroom is to say, look, I know UCLA is one place they've done a lot of gathering of data in the schools, particularly around UCLA, but I wondered if you have any other suggestions about data sources to bring mindfulness into the schools. So one about consciousness, one about data.
Great questions. The first one, consciousness, like you said, is very abstract. The way I define consciousness is the observer of the thought. So there is a thought, and then there is that mind that's thinking. So the mind, to me, is the consciousness, and the brain is the thinker, sort of. So there is a change. I personally have noticed And that comes from regular practice and also letting our minds get bored and frustrated in a sensory deprivation mode. Did you want to add to that?
I guess the idea of consciousness, also another word for mindfulness is awareness. And so I believe that when you develop, I guess, a better practice yourself of mindfulness, as you develop more awareness, then there's more consciousness and conscious awareness of everything, of what your feelings, your emotions, your behaviors, your attitudes. The more mindful you are of what you feel in your body and your thoughts and feelings, the more awareness you have and a greater consciousness. And I can tell you from my own personal experience in working in my therapy practice, just beginning to introduce it a couple of years ago with breathing and helping people to use that to calm them and to be focused has been tremendously helpful.
The second question, I think, was about schools. So in this ADHD report, we did have a section on schools. So there are some research resources, the references. But in terms of tools, we actually covered TANGs. Which grade are you looking to introduce it to? K through 12. So TANG and TEAM in Australia, which we mentioned here, they talk about adolescents, mindfulness particularly for adolescents. But I actually have a book that I use a lot for mindfulness for kids, and it's an amazing workbook. Maybe I send you the name of it.
Yeah, we can. Any resources that come out of our discussions here, we can certainly share on social media and perhaps in future emails that we send out.
I'm curious, you mentioned a couple of times the utility of mindfulness in dealing with anxiety. Since I tend to think of anxiety as being in excess of stimulation by the present, I wonder how mindfulness can be used to balance.
That's a great question because it's my favorite. I actually published a recent paper with Dr. Chopra on that particular topic, how mindfulness, actually stress, as we all know, kicks off our fight or flight response. And that creates anxious thoughts, anxiety-related activities in ourselves. What mindfulness does, so how stress works is our receptor neurons, which are connected to our sense organs, like seeing, listening, we get a stimulus that's potentially stressful. It says, okay, you know what, this event is potentially stressful. Maybe someone yelling, we hear that. The receptor neuron goes to the brain. And that integrated information in the brain gets evaluated against past memories, what we think are similar to this. Now, if I was an anxious person, I would err on the side of caution and say, trigger my stress response, which is my anxiety response. And immediately my jaws would tighten and all the things that happen. Your muscles tighten. Now, when you introduce mindfulness, on the other hand, what you're doing is intercepting at that point where the brain compares the stimulus to a past stimulus and decides to raise a red flag or not. So as you practice mindfulness, you bring a pause between in that decision-making process, which is really a second of, or even a fraction of a second of just tuning into our senses or breath. That's all you need to intercept that. And that's basically a skill that you could build we could build into combating anxiety.
Thank you. We have time for probably 2 more questions before we move into our meditation exercise. And I'd like to hear from people who haven't already asked a question. That's all right.
A word that I think about in conjunction with this conversation is choice. And when you talk about the muscle of mindfulness, it seems to me that what happens is, and what was so evident with the school kids, that they discovered that they could actually make choices that hadn't even occurred to them before. I wonder if you can speak to that.
So I guess what comes to my mind is a lot of what you were saying in terms of how we connect our interpretation of the present to what's happened in the past. What came to my mind was we're on autopilot. So with those kids, and what we also all experience is the repetition of even feelings and thoughts that come up with something that feels or looks something like we've experienced in the past. We go into autopilot mode. And so the idea of choice is a great concept, because what you learn with mindfulness is to take a step back and pause and notice what's happening in your body and what you're feeling, and see that at that point there is a choice. You don't know it because you're on autopilot until you become mindful and aware of what's happening.
I'm wondering about mindfulness practices in non-North American cultures. Is it integrated into the schools, into the family life? But I know it's a big planet.
So fortunately, I did grow up in India. It's very culturally integrated, but that didn't mean that I really adopted it until I grew up and I started noticing, yes, there is a connection between the mind and body. But I must say that there is a difference of how in India, culturally, we grew up to perceive a stressful, potentially stressful situation, and with a sense of surrender. Not that we won't act on it, but there is also, after action, there is so much you can control. And that's something I value from my upbringing.
We have time for one last question.
My question is, as a parent, if you decide to do this and you learn it, do you have any suggestions in terms of breaking down that barrier to get your 3 teenage daughters to become enrolled in this as well?
So, as a parent, there are a few steps to practicing or introducing mindfulness to our children. It's first because we are modeling a behavior that we want them to adopt, it's a great idea for the parent to actually start their own practice. So reserve a time during the day that works for you and you're not interrupted every day. 10 minutes, 15 minutes, even better, or 20 minutes a day. Practice that. As you do that, I also recommend, because your kids are teenagers, there are ways to incorporate mindfulness in playfully almost with your child, 5 minutes a day. You could, for example, introduce an art, appreciate a craft making session with them, but you could do it mindfully. So share because of their age. You can actually share as a peer what you're feeling in your senses and listen. If they say something, share something, repeat what you're hearing. That's the second bullet point of how to introduce mindfulness to your kids, as in the relationship with the child. And the third thing is also I find helpful to have not time out. I agree with you about the mindful disciplining. Kids do need discipline, or just like plants need pruning to flourish. But that could be done in a mindful way. One thing that I found effective with parenting is introducing a mindful breathing space to ourselves, sometimes to our kids. And along those lines, the fourth point is to be able to label an emotion. So if something is coming up, what is the name of it? Like if you had to describe an emoji, what would that be for that? And doing that for yourself as well as your child is very helpful. And there are ways of practicing this. I would recommend practicing all of these when we're calm, so we can use them when we need it in a stressed out situation.
Nicole, I'm just curious, you mentioned at your beginning a program, a workshop for middle schoolers. Do you find that most of the middle schoolers who have signed up have parents who have also already done workshops, and so it's something that is they're aware of in their families?
So I think it's more that parents have asked, or these are children who are experiencing anxiety, and it's interfering with their ability to function in a way with their peers, or just they don't like the way they feel. So the parents have reached out. But to answer your question, the parents, I'm trying to get the parents to consider, so the kids have come for help through the parents bringing them, but the parents themselves, it's just a hard sell for a lot of people.
So as we transition to do a brief exercise, 5 minutes, 1 minute, 2 minutes, it's going to be led by one by Ayman and one by Nicole. I just have a couple of announcements. When we do break up this evening, not permanently, everybody's welcome back on February 15th, but if everybody from the Documentary Discussion Series Committee could come up to the stage and take a picture with our panelists, that would be great. You will have a little bit of time before they turn off the lights in the library. And if you feel that you need to leave, if you don't want to be present for this, or if you get up at any moment while the program is still going on, if you could please exit through the door on this wall, it's less disruptive to everyone who's still enjoying the program. Okay, so with that, I'd like to turn it over to Ayman. I think you're going to lead us through the first mindfulness experience.
So just to preface, we're going to do a body scan, a brief
Sorry. So we'll use the body as a tool to sort of intercept stressful situations when they arise, because stress actually tenses our bodies up. And as we grow up as adults, we gradually lose touch with our bodies. So body scan is actually an invitation to reconnect with our body, getting to know it. Now, because we are going to do it for 5 minutes, I'll focus on 2 areas of the body. First, to get the posture right, I recommend sitting with our legs apart and feet firmly grounded on the floor, so you can feel the 4 corners of each of your feet. And now, place your palms, because it's a little cold, it would be nice to put your palms down on each thigh. Shoulders down, rolled backwards. And pretend that you are a puppet. You have a string attached to the top, very top of your head up to the ceiling. So your chin is parallel to the floor. As we begin, please, if it's available to you, gently close your eyes. Take 1 deep breath as I guide you through the nostrils. Feel the sensation of the breath going down the nostril, back of the throat, expanding your rib cage in all 4 directions. And then your belly muscles completely loose for this, expanding, ballooning out. Notice the transition between an inhale and the exhale. And then notice how your belly gently sinks, your rib cage weaves in. Notice the air passing up the throat, out through the nostrils. Maybe even notice the temperature of the exhaled air to be slightly warmer than when you inhaled. Now I want you to do this second one at your own pace. Now, focus on your feet from ankle to the toes. Notice your 10 toes. Notice if you can feel any sensation at the tips of the toes, any tingling, any numbness, or no sensation at all. You might also notice if you're wearing socks or shoes, the touch, sensation of touch of that fabric. Notice the gaps in between your toes and wherever they touch each other. As you do this, thought may come. If that happens, and it will, make a note of that. If the thought is charged with emotion, label it emotion. And then, as you would watch a white cloud in the sky, watch your thought pass by as you bring yourself back to the sensation on your toes. Notice if it's sweaty, without any judgment, of course, or dry. Now, bring your attention to the soles of your feet. You're working all day very hard, moving around using these soles. This is your time to relax them. Also noticing the four corners, if you can imagine, of each foot touching the ground without any effort. Bring yourself now to the tops of the feet. Any sensation of the fabric or the shoes on that? Perhaps how your feet are positioned on the floor? And now gently bring your attention to the ankles of both feet. Notice if you can sense the two ankle bones protruding on each side. Now, take a deep breath in through the nostril like you did before. Notice it passing through your back of your throat, your chest expanding, your belly rising. Now, in the eyes of your mind, send this breath down your legs to your feet. Gently hold it for a moment right there. Imagine it's caressing the feet. And now, send it back up your legs, your belly, your chest, through the nostrils. Next, bring your attention to your head and face. Notice how readily your attention moves to this completely different part of your body. Again, thoughts may come, and that's what the mind does, thinks. Just make a note of it. Watch that it's there. If it's an emotional thought, label emotion, and then watch it pass and bring yourself back to the sensation in your jaws. This is often the place where we hold a lot of tension. See if you can gently have your teeth apart from each other, the top and the bottom, so your jaw muscles loosen a little bit. Bring your attention to the sensation on your lips, the insides of your mouth, the gums, the teeth, the tongue, the entire mouth full of sensations. Bring your attention to your cheeks, cheekbones, nostrils, the sensation of air passing through it, the tip of your nose, the bridge of your nose, the outer corners of the eyes, your eyebrows, your forehead, your eyelids, the eyeballs sinking into the back of the eye sockets, sensation on your ears,